This meeting is being recorded.
Okay, well, welcome, Katie. We're so glad you're here. I was just mentioning to people that Lori and Rob Byron are in Mongolia this week, and Elizabeth De Bono is in University of Michigan for a retirement party for her mentor. So she's left things in Catherine and my hands, and we are super excited to welcome Katie. Just a bit about Katie, Dr. Katie Lichter, is that right?
Yep, Lichter.
Katie is an MD MPH, a resident physician in the Department of Radiation Oncology, and a climate health fellow at the University of California, San Francisco. And her work centers on the interface of cancer care and climate change. And she works to raise awareness of the impacts of climate change on cancer patients, builds partnerships among providers, professional societies, and health systems to promote climate health action. And Katie is also a co-founder and principal investigator for Green Health Lab at University of California, San Francisco. And we'll hear more about what that lab does, I'm sure, in the upcoming hour. And then Katie, I'll let you do your presentation, and then we'll offer time for questions, unless you prefer to have questions as we go along. What is your preference?
No preference. So I guess why don't we go ahead and people can certainly jump in, ask questions as I go, and then certainly plenty of time at the end for questions as well. I will absolutely not take up your full hour here.
Well, excellent. Well, let's go ahead and get started. Welcome.
Great. Well, thank you so much for having me. I'm honored to join your group today. I've recognized many people both in the crowd and on the email thread that are my own mentors and some of my climate health heroes. So I'm honored to be talking to your group today. So as was mentioned, my name is Katie. I'm a resident physician in the Department of Radiation Oncology at UCSF, where I'm also a climate health fellow. And so some of you may have heard this presentation already, but I'm going to steal my old presentation from the MSCCH meeting back in December, and I'll provide some updates to some of these projects as we go. So the focus of that presentation was decarbonization of the healthcare sector. And really, I want to focus on my role as a young resident in this space and a young investigator and what we all can do. So I like to think about how we all have a climate journey. Many of us have a story that led us to be here today. And mine actually isn't so unique now with the last month. Unfortunately, I think a lot of other people may have a very similar climate journey to my own, especially with things going on in Canada and New York. But my climate journey started in San Francisco back in 2020 amongst the COVID pandemic. I was a bright-eyed, bushy-tailed intern, as we like to think, coming in, hit by the pandemic, but was really excited to be moving to San Francisco with my partner, who's also in the climate sphere in terms of investing. And we're really excited to live a more sustainable lifestyle in the Bay Area with other folks that we thought were very like-minded. And so I remember walking home from a overnight shift in the wards. And, that day in particular, I was unable to take off my N95 mask despite leaving the hospital. I walked home and, met my partner, and we grabbed our sustainable bags, reusable bags, and we're walking to the market. And, just after having been in the ICU overnight, I had just treated a patient who had advanced non-small cell lung cancer, who unfortunately was now admitted into our ICU with progression of disease. And he had been unable to access his essential chemotherapy and radiation due to the wildfires that were going on around him. And as I, had shed all of my gear off of, leaving the ICU, except for my mask, I started thinking there must be something more. This isn't about just simply the reusable bags that I'm taking to the grocery store, but what can I do to not only have this more sustainable, climate-friendly lifestyle here in my own life, but bring that to work. And that's really what led me to ask the question, why isn't anybody talking about this in healthcare? And I was silly enough to realize, or to not realize at that point, there are many people who are talking about this. And that's really what kick-started me into this work. So since starting, I really have focused my questions and my areas of focus on three things. And that is, one, how does climate change impact cancer care? Two, how does cancer care impact climate change? And then three, how can we organize around these ideas to inspire the change that I wanted to see? And these words really boil down to three words that I know all of us are very familiar with: adaptation, mitigation, and advocacy. And then as an early mentor at PSR encouraged me to do was to think about my spheres of influence and always push the boundaries about, how do I not just have a QI project that sits within my own department, but how do I think about going beyond my department and influencing my institution, my specialty, and the broader healthcare community? And so these are the frameworks that I really have used to address all of my work to date. So just briefly, focusing on adaptation, what I wanted to do in our work is we looked at our UCSF radiation oncology department, and I was curious, are patients actually missing visits during these times of wildfires? So we first initially analyzed our data and realized we did see an uptick in mistreatment visits. And that is significant because we know mistreatment visits for essential care and radiation and chemotherapy do have impact on survival. And we've seen that here in some hurricane data and work that's done out of American Cancer Society. So what we did is a multi-pronged project, but essentially not only captured mistreatment visits from our department, but then expanded that to the other institutions in California and captured this data from both academic institutions as well as private institutions, and are just in the process of looking at what does that mistreatment visit look like and what are the outcomes that we're seeing here retrospectively, and then bringing some of that forward prospectively. We also did a survey of our providers across California. Here in gray, you see where all the providers are. I apologize, it's a little small. And then we actually mapped it out to the wildfires that had taken place from 2017 to 2021. And we found out that, interestingly, 100% of all of our clinics were within 25 miles of a wildfire. And that certainly is true within our survey data. We found that 61% of our physicians reported impact in not only patients' treatments, but as well as their facilities and their staffing, with some physicians even having to move patients to a new location and stop their treatments. And then we are also looking at how proximity affects overall survival. Thinking about then, how do we expand upon this? There are a lot of residents and medical students who are very interested and engaged in this idea of climate-fueled disasters impacting care. So what we're doing right now is also working with residents across the U.S. to not only look at wildfires, but to look at other climate-fueled disasters using the same survey and just adapting it, using the same NCDB analysis and some of our statistical skills and the mentorship from American Cancer Society to look at things and states, including Texas, Puerto Rico, Florida, and really understand how this is impacting our patients. For a specialty like my own, data has always been key. And in order to get more people to understand this story of our patients and our communities being impacted by climate, I really want to start with collecting some of that data. Then, certainly the work doesn't stop with making the story, but then really we'll focus to this word here up at the top, which is adaptation. How do we actually, once we know who's most vulnerable and most susceptible to such events, how do we build in resiliency and adaptation? And really look forward to working with HHS and OCHI and many different institutions in terms of transitioning our work to the adaptation efforts. The other component that I've been very interested in as well is mitigation. So understanding certainly that we have an impact on climate change as well. I would say most of my work has boiled down into three categories here, and that's waste audits, life cycle assessments, and then one that I found to be low-hanging fruit, but certainly an area impact is looking at conference emissions as well. So I'll just briefly touch on each one of these, but they have a long story behind each one of them. I'm happy to dive in if there's a particular topic that's of interest to others. So starting with waste audits, we started with waste audits at our institution at UCSF as well as Stanford, because something like a life cycle assessment to quantify your emissions is certainly a huge undertaking. And so with our work, we've tried to lower that threshold and increase more people's engagement in this. So we have a very common procedure in radiation oncology. It's called brachytherapy. And we decided to start here because we know that ORs are a significant producer of waste as well as energy. And then we created a waste auditing template. Essentially, this is a slide from another presentation, but we found that really very simply, we were able to bring in 2 student auditors, very minimal supplies were needed, just a phone and a scale. And we focused on weighing and understanding not only our landfill waste, but also our red bag waste. Really focusing in, on that red bag waste, because we know that red bag waste, not only is it oftentimes 2 to 5 times as expensive to dispose of, but it also has significant environmental impact that is associated with the incineration. Sometimes, for example, the red bag waste will actually leave the state, be incinerated, and then be brought back to the state. And that incineration process has toxic associations, that ultimately cause environmental impacts, that going into our streams as well as our air quality. And so we were able to find out, that only took 6 minutes, very quick. And with that waste audit, we're able to essentially completely eliminate all of our biohazardous waste in our own department. So it wasn't that interesting once we started auditing. We realized that this kick bucket that sits underneath the surgeon's foot was actually red bag waste lined right here, which you can see, and it did not need to be red bag waste. It could actually be landfill. So it was inappropriate understanding of what goes into red bag versus landfill. And with this simple exchange of the kick bucket, we are almost completely able to eliminate our red bag waste. Then, one thing that we have done to lower the threshold, again, for other specialties to do this, is we started creating, up here for UCSF, education tools. So not only to put in our department, but to spread across UCSF. Now that we understood more, what is appropriate for red bag waste, how can we share that with other departments? So we've been creating education tools to disperse in UCSF as well as Stanford, tools that are not only specific to brachytherapy, but more so, can be used by any specialty. Then with, again, with that goal in mind, we were able to use this project as a GME project. So all of our residents were able to get credit. And that's really how we also were able to get interprofessional collaboration on this project, and really, was able to corral a lot of different folks around a common goal. And so we thought, this is something that was fairly easy to do. It takes 6 minutes. And even with some of these AI tools that we've been using now more recently, it's down to 60 seconds. But we knew that there was an opportunity to create a waste audit toolkit. So that's what we did with the Stanford residents. Now have what we call a NorCal waste audit toolkit that we have been dispersing to many different institutions and residencies. Again, focused on lowering the threshold, but, would emphasize that this doesn't necessarily need to be a resident project. We have, two different modules, and one is, a year-long waste audit for a project and where residents may be looking to get credit. And then a second one is just more for community practices. How can you do this in a month? How can you just start to look at some of these things? And then this is getting implemented into climate resources for health education, for those of you who may be familiar as well with this. On the topic of life cycle assessments, so this is, for those who may not be familiar, life cycle assessment is really looking at an entire care pathway, or you may be looking at a specific item that you use in the clinic and looking at everything that goes into that care pathway, all the way, upstream from the make of supplies that go into a process all the way through disposal. So this is really where I started my first journey here within radiation oncology. And I said, in order to reduce our emissions, we're going to need to understand or to quantify. So life cycle is, what we saw Jody Sherman and Eckelman do in terms of the US that allowed us to have that number to say, look, the US healthcare system is responsible for about 8.5% of all greenhouse gas emissions. And I knew that was going to be important for oncology to have that number as well and to focus in on hotspots. So our work has been focused on thus far looking at radiation oncology because it's a treatment that over 50% of all oncology patients will get, and answering, where are emission hotspots. This is just a snapshot from our initial findings, which we're excited to be publishing here this summer. But we found that actually a majority of the emissions, which is yellow here, is from transportation. So everybody immediately looks at our big machines and says it must come from electricity, or, this is going to be very complicated. But when we found out, it's actually not that interesting. It kind of looks like the US data, where emissions and transportation are driving a lot of our emissions. And for those of you, who may ask why, well, for radiation oncology, oftentimes patients are coming to the clinic every single day for treatment, sometimes up to 6 weeks. And then they are coming for initial consultation and follow-up care. So there's a lot of appointments that go into this. Yes, is this going to be hard to address? Yes and no. There is discussions within our field about hypofractionation. So we know that many patients can be treated with much fewer treatment days, as little as 5 days, but the reimbursement looks different. And so with this data, it allows us to bring that to I guess, the folks in DC and bring one more argument to the table about hypofractionation. The other thing that we did here at our institution is, one day when I was coming home from the airport and getting an Uber, I, certainly was able to choose Uber Green versus conventional Uber on my way home from the airport. And I thought to myself, well, why can't we be using Uber Green for all these patients that were already using Uber to schedule their visits to and from the clinic? And so we were able to pilot last year use of Uber Green for all of our patient transportation, and found significant reduction up to 79% with no change in wait times or pay. So we actually partnered with Uber and are working with them. They actually built us out a platform to be able to use Uber Green to pre-schedule all the visits, not only for radiation oncology, but for UCSF. We know that this isn't a possibility in all cities, certainly, but I think this is, a good starting point, and we're excited just to use low-hanging fruit. The other things that we've done along the way is figure out templates for LCA. So a big thing was how do we get multi-institutional data? And so onboarding other residents, you can see that here from this picture. We onboarded 5 different facilities across the US and several international clinics as well. And with the help of LCA experts, we've been able to, LCA experts, I should give out a call to Cassie Thiel. We were able to build out templates for other residents to use and do this data collection, and really excited again to be working with many other collaborators to adapt this. So it's not just radiation oncology. I certainly know that radiation oncology is a very small percentage of all of healthcare. So look forward to that. The last thing has been focused on conference admissions. So I saw this again as a low-hanging fruit, but an area for engagement and building awareness. With the transition to virtual and hybrid conferences that happened during times of COVID, what we did is just essentially look at admissions pre-COVID and then during times of COVID, but also look at increased attendance. And we're able to take this to all of the conferences that we went to. Using our methodology, we created an online platform, and happy to share this afterwards. It's just in beta version right now, but it's called Network Without Harm. So essentially, any individual can log in and calculate what would my emissions be if I were to attend this conference in person versus virtually. But also allow for conference organizers to do the same thing, because we know that in-person networking time is absolutely invaluable, and that does not necessarily need to go away completely. But hybrid options are a great alternative where we allow for both of those, and also allow for more inclusion and accessibility and diversity into our meetings by having these hybrid versions. And so by having this calculator, we really want to encourage our conference organizers or our departmental staff to log in and say, what would it mean if I hosted this conference and 50% were hybrid, or 25%? What are my reduced emissions? Or, for example, what if I didn't require my junior faculty who are balancing a lot of things, what if I didn't require them to go in person, but allowed for that virtual attendance? What are some of the additional benefits, such as environmental benefits? And then down here too, this is just a screenshot of, up here is where an individual would calculate their emissions. It spits it out. And then we also wanted to use this opportunity for education and awareness about offsetting emissions. So not getting into offsetting in terms of carbon purchases, but just what are lifestyle changes that people can do? How long would they have to be vegetarian, not eat meat? Or how long do you need to live car-free in order to offset those emissions from going to a conference? And then the last component that I talked about is advocacy. And so really thinking about how can I use my spheres of influence to grow the sphere and see the change that I want to see. So this is just a note, what started with a sad intern walking home on a day that the sun didn't rise, went to a collaborative resident-led grassroots group of over 30 residents within radiation oncology. I found not only was it residents in my specialty that were interested, but in fact, there were many, many medical students and undergraduates who were looking to work on similar projects. And that's ultimately why we also founded a Green Health Lab based out of UCSF. And this is just a snapshot of some of the folks, but now, over 25 individuals working collaboratively on these projects who, the students and the residents really are the drivers behind these projects. And, with these two groups, really was able to lead change then within my larger professional society. So we often think about change can be bottom up or top down. And so as a first year resident, I started bottom up, and excited to share, that we not only had a climate task force that was started in March, but actually very timely. We today found out that our climate change policy was approved by the board of directors. So we're very excited. That was done over the weekend. And then this is just a note, what can we all do when we use our spheres of influence? I think it's a lot of these grassroots groups like yours that really are creating a lot of change. So excited, for more collaborations, and certainly, welcome any questions. So thank you.
That was awesome, Katie. It's as you were speaking, where have I heard this before? And I realized even though I didn't get to go, I listened to your talk online on the websites that were released from the conference, from the Medical Consortium conference. And I remember when I heard you speak, I thought this talk is really outstanding and passionate. And I'd like to open up the questions today. I'd like to have the luxury of asking you the first question. I was really impressed when you spoke about how to get others involved and engaged in advocacy. And I wondered if you might comment on that and some of the initiatives that you've told us about, and how you might get other residents and trainees involved in climate change and health.
Sure, absolutely. I think it's been two things. One is the story and making the link. So I think, unfortunately, our medical students, residents are seeing the impacts every day, and are having these aha moments like myself, and really making the connection. At first, when I entered the sphere, I wasn't even sure what is that link to oncology. And it wasn't until that patient showed up in my clinic, on that same day and had missed treatment. It wasn't until that moment, and I really started making the link. Okay, how else is this impacting oncology? So I think sometimes it actually takes sort of holding hands and making that link and telling the stories that can be really impactful. And then, once people understand and make that link, there's a lot of excitement, fear, angst, but most often I see that people want to participate, but they feel pulled in many directions. So the thing that I've been trying to do is answer the question of, how can we lower the threshold? How can we allow for many people to take action? And I think that's what, the lab, and that's what these projects really have been focused on. I really credit the folks at PSR for encouraging me to think about, how do you make sure your quality improvement project isn't something that's just your eyes only? How do you make sure that this is something that other people can pick up and they can duplicate or they can expand on? By being pushed to think that way, I think that's also what allowed me to think about projects that we can disseminate and lower the threshold, toolkits, templates, etc. Because oftentimes people just feel like, I can't take on one more thing. But by lowering the threshold and having teams where it's collaboration and, we're in it together, as cheesy as that may sound, found that people really, really enjoy that collaboration.
Yeah, I think that's the spirit of CCL, which is I don't know, are you involved in Citizens Climate Lobby yourself, or?
I'm not. I actually know very little about it, but my curiosity is piqued.
Oh, good. And I might defer to my co-lead tonight, Catherine, to tell you more about what we do, or anyone else on the call. But as you were saying that last piece about really trying to work together as teams, it reminded me of how groups like the one you're speaking to tonight, the Citizens Climate Lobby, which is far beyond what we're doing. We're simply one action team within CCL, the health team, but it's huge, more than 200,000 volunteers, and there's definitely power in teams. Would anybody like to give Katie a brief overview of CCL? Would you like to do that, Catherine, or?
We can also connect offline too.
Yeah, I can't think of anything to add to what you just said.
Yeah, we'll connect offline. We want to probably focus this time on questions for you. So let's open it up. Who else might have a question for Katie?
I actually have a comment and a question. Thanks, Katie. That was really awesome. I enjoyed hearing it. For some reason, I had missed that exact talk when you did it before. My comment is, I really love that conference footprint app that you had at the end. And I hope that when it's out of beta testing, you'll be able to share it back with us, because I think CCL would actually be interested in that app as well. My question is, one of the things that Citizens Climate Lobby is working on is an economy-wide price on carbon. So we kind of look at emissions across the economy. And we know that healthcare emissions are 8.5%, but actually healthcare being such a giant portion of the economy, I think 18 or 19%, it's not a super high emissions thing. And as I've learned a little bit about calculating healthcare emissions and understanding about scope 3 emissions and how important they are, it has struck me that I'm not sure whether other industries are looking at emissions in that way. Like when we hear, let's say, big tech talk about it, they're always talking about their electric use and how they're going to go 100% renewable electricity. But I'm not sure if other businesses or industries are really looking at their scope 3 emissions. Are you aware of whether that's happening? And are there, if so, are there practices that healthcare could borrow or share with other industries regarding measuring scope 3?
Yeah, I think scope 3 can really vary between industries. And yes, I would say in general, all sectors are looking or are required to investigate scope 3. But what that entails more so varies. So for example, even patient transit is not technically required right now for emissions reporting within healthcare. When we do think about scope 3, if we count that in, that is going to significantly impact our scope 3 emissions. So I think similarly within other sectors, we would see very similar things, especially on the consumer side. And I think, as far as our role or learning best practices, I think is to run similar life cycle assessments and understand what is our biggest impact within scope 3. So certainly we know pharmaceuticals are a huge component of scope 3, and OR supplies is a huge component. And so I think each specialty will look very different. And so making sure that, if we find these things that we can't brush it under the rug, but rather let's add it in. So, UCSF technically doesn't need to report patient transit under scope 3. But just because we're not required to report it, does that mean we shouldn't be trying to tackle it? So, I'm not sure about best practices per se, but I think that scope 3, with just considering how big it is, this is something that we should definitely put all eyes on. But until we do formal analyses of our different practices, we won't know what that looks like, because a lot of what we know about scope 3 is only based off of purchasing right now, right? Is based off the financial component, EIO models of LCAs.
Great point.
I would love to hear your thoughts. Do you think that there's best practices to learn from other industries in regards to scope 3?
And I don't know any other industry, so but I think that's a question that maybe within CCL, I don't know if we're looking at. So I just think it's an interesting question as we think about what the broad spectrum of what has to be done for us to actually get emissions economy-wide in control.
Yeah, and I mean, I think the nice thing, I guess, maybe best practices is that there are a lot of tools coming out in order to quantify scopes. What are your scope 1, 2, and 3 impacts is for businesses, again, done with the financial data. And so looking at this is getting easier and easier. And I think having an understanding of how businesses are doing it, and whether that's onboarding clinics or hospital systems, that's definitely an option. But I think it is key that we all understand, or a component of us within healthcare understand what that looks like.
Great. Other questions? Catherine, did you have anything you wanted to ask?
No, there are probably lots of questions that'll come to my mind once we end the meeting. So maybe if you have an email or a website that we can go to if we have further questions about this, about all of that you talked about, does that exist, Katie?
Absolutely. I'll drop it here in the chat. but my email is just my first name dot last name at ucsf.edu. I also
Okay.
dropped in here the Network Greener website that
I
we put
noticed
together
that.
for conferences. So big thing here,
Yeah.
it works right now, but we just don't have our methodology because we're waiting on the publication of the paper for that. So we don't have our methodology to back it up on the website, but feel free to check it out. Also very open to feedback or suggestions while we're waiting for this publication. And then I'll also drop the webpage for our lab, and feel free to connect with me or connect other folks who may be interested with myself or my co-PI, Osama Mohammed. But
one thought I had as you were talking about the conference related emissions is trying to group conferences. I mean, we have to be careful. We're not going to be making them overly long or taking too much time away from work. But for me, it worked out really well. I'm giving a talk at one conference and then in New Jersey, and then I'm giving another talk at a conference the next day in Philadelphia. And, it makes me wonder, I'm just going to drive 2 hours between the two, rather than having two different conferences with flights and all. And it just makes me wonder, that might be another thing to think about, is trying to group conferences together. Because a lot of times we have to choose which we're going to go to anyway. And it's so exhausting and expensive going back and forth. And this way, it could be, it could be that you go to one and then you just piggyback the other one on. So it's just something to think about in your.
yeah, absolutely. In our paper, we ran different simulations. So what are the what if we look at hosting conferences back to back? What if we have 25% hybrid, 50, 75% hybrid? Or what if we do hub and spoke models? So we see that, the most significant impact is coming from our international attendees. Does that mean we shouldn't allow for international attendees to come or to participate? Absolutely not. But what if we had hub and spoke models where the international attendees met in locations that were closer to themselves and then zoomed in? Or what if we host the conference every other year instead of every year? Or these are all the different simulations that are run in the paper. And then what if we had the conference in a central location that minimized travel for most people? So what if that's in Chicago or somewhere in the Midwest versus having a really nice Maui, Hawaii get together where everybody is flying across the ocean? Again, like the big takeaway was actually that the hybrid conferences are key. Virtual and hybrid. So, if whenever we can incorporate or ask our professional societies to think about extending that would be key. And I think that's, what we want to do with the paper, because we know that conferences are where professional societies make money, and we cannot ignore that. And that's, how vendors are making a lot of money as well. And so how can we adapt or change to allow for continuation of hybrid and virtual options? Again, with the idea that this also expands inclusivity and access. I think that's going to be key from an awareness piece. And really we hope it drives, because some conferences want to charge people twice as much for attending virtually. But I don't think that's the answer. We have to change with the times. And this is something that we can encourage and help our professional society.
I love that idea of the hub and spoke. So the idea would be like, let's say there's a bunch of international people coming from Europe or Asia or whatever. They could gather centrally without having to do the overseas flight, right? And then they could network with each other at the same time that they could see these speakers and all. I think that's a brilliant idea. I really do, because that's probably the people that they're going to be most interested in meeting up with anyway. So that's, I think there's some really, and what I love about this is it's not just related to reducing emissions, but it makes for more efficient, more enjoyable conferences. Also the idea of a conference might get more attendees if they backed it into another one, right? So that you could get both at the same time.
Right, right. And you could even have, that hub and spoke. I think somebody just made a comment on it too. That hub and spoke can exist here in the States too. So you could have something in the Midwest, the West Coast, East Coast, and a central location where other folks can come if they want to come. But there's a lot of, as you mentioned, there are a lot of options to think about with this. So, and the point being that we don't know until we encourage conferences to try it, figure out who attends, collect the data on what people think of this. Is networking affected? Yes or no, and other things, and go from there. So a lot to be determined.
Yep.
But I'm
Katie,
gonna have to jump. Yeah, sorry.
I think to your point, find that costs for the professional societies, being to a virtual or hybrid, I think that's a better payment when trying to promote the virtual or hybrid formats rather than say the savings attendee would benefit from.
You're kind of cutting out, but I think I agree very much. So.
I'm sorry,
Yeah, Katie, we really appreciate you joining us. We realize you need to go, and thank you so much.
Well, thank you so much for having me. It was very nice meeting everyone. Have a good evening.
You
Bye-bye.
too. Bye-bye.
Thanks very much. Bye.
Great. Is there any other business that we need to attend to that this group would? Go ahead, Catherine.
Well, I wanted to ask, since there's discussion of possibility of discussing something connected with our conference. I'm surprised. Has there any? I guess I assume that somebody was collecting data on what percentage of CCLers prefer to connect in virtually versus the ones that prefer to go. How does that do? Like for this one conference that was this month, I have no idea of what the percentages are. And possibility of hubs. It seems like we as an organization, that's something we should be in leadership on, in a sense, since we're a climate change organization.
Yeah, that's a good point. Anybody have any thoughts or know anything about?
Well, I don't know, but I do know that both cost and concern about carbon footprint is a barrier to people, to CCLers attending the conference. And I know even from working in my own chapter that, we've had hybrid meetings for months coming out of the pandemic, and lots of people love to be in person and lots of people always want to be on Zoom, so I think it's good, like she said, to try to figure out how can we meet people's needs for modern times. I think it'd be a good thing to have a conversation about with CCL staff.
I know from our the chapter in Kentucky, I belong to the Northern Kentucky chapter, even though I'm in Eastern Kentucky because we don't have one here. But they said from the whole state of Kentucky, there were like 7 from CCL there, which isn't a big number. And, for me, there was no way, and you can drive from, our part of Kentucky. It's a good drive, but it's possible, but not everyone really has that luxury. And I know for me, COVID was finally a chance that you were forced really to use social media and Zoom in that. And at least for me and many in the same situation, many things I would not have gone to, I couldn't, but I could by Zoom. And like our meeting, there's no way we would be in contact as frequently without Zoom. And I attended one out of Ohio State. They had one year, the whole cancer conference for several days. And it was fantastic. They had even like a lobby with different vendors if you wanted to go to them. And I know there's advantage, of course, in live interaction and that, but I think we can't just drop it, because for so many people, it really is the only way you're going to be able to really attend things, and that, not even to mention the carbon footprint.
I think there are also creative ways to network at some of these meetings. Like I was able to do some, I think, what was it? I think it was a science communication misinformation conference, and they were able to set us up in these rooms where we were able to do these simulations, and it was really great. I mean, I think that ideally you see people, but you can learn a lot. I mean, we all know from all the networking we've done, including on these kinds of calls through the pandemic, that you can really develop some great relationships with people. I know there's no substitute for hugging them in person, but but yeah, I mean, I think we've really come a long way in realizing the power of online and Zoom and other platforms. Great. Well, we can end a few minutes early today. I think this was really a great session, and I appreciate everybody attending. I think it meant a lot to Katie to have a nice number of people. And if you check out the chat, her email and website are there. We'll get the recording out. Lori will take care of that. So just give them a few days to get that together. And Catherine, I appreciate your help, making sure everything was set, making sure we did the test runs, all of that.
And I really appreciate your being willing to host.
Of course, it was my pleasure. All right.
Thank you both so much.
You have a great
Good to see
night,
everybody.
and
Thank you, Catherine.
we'll connect soon.
Thanks.
Bye-bye.
Bye.
Good night.